Good afternoon, everyone. Looks like we got one more minute and then we'll get started. If you haven't done so, please take the time to introduce yourself in our chat. My name is Misha Mears. I'm a Community Engagement Coordinator here at Oregon Department of Human Services Self-Sufficiency Programs. I use she, her pronouns, and I do have my contact information in the chat in case you ever need to get a hold of me or have questions. Looks like we're at 2:05 now, so we can get started. Couple little announcements before we get to our first agenda item. First, I just wanted to let you know that we will be recording today, so just a good practice to let you all know that you will be recorded. So I hope that is all right with everyone. It is definitely helpful to have that recording available on our YouTube so that the folks who can't be here still have the opportunity to hear the information and get these updates. I did notice that our usual cart captioning service that is here to provide instant captions is not here today, but we can use the closed captioning available on through Zoom. So please utilize that if you need to do so, and we'll figure out what happened and how we missed them for this particular meeting. Real quick, I did want to check in with folks. So we last month started something new. You all were added to a listserv, and that's how you received the invite to this meeting and also how you received the follow-up from our last meeting. And I just wanted to check in and see how that worked for everybody. Did it work okay? Any questions? Feel free to give me a thumbs up. Thank you, Sandra, or put it in the chat, whatever works best for you. I just wanted to check in. All right. Couple thumbs up. Ooh, some claps. I like that. That's good. I know James, welcome back, James. He's enjoyed getting all of these messages that happen as I add more people to the listserv. James is also going to help administer that. All right, so we do not have an official slideshow today, and I have a question for y'all. I can share the agenda so you can visually see it, or I can just kind of walk us through it and you can see everyone's lovely faces as they are speaking today. And either way is good for me. Does anybody have any thoughts on that before we get started?
Hi, Misha. I actually have a third alternative. This is Antonio with the team. Since I'm going to be presenting some information, actually, I was hoping to share my screen. I was not going to come on camera. Is that okay?
Yeah. That's fine. I know we have some partners that will be sharing too. So that is definitely no problem there. Yeah. And with that, I believe that you are the first up, Antonio. So if you would like to share your screen now, that's great.
Yeah, hi everyone. This is Antonio Oras with the SNAP policy team. I wanted to give a quick update as to regarding the changes that will be impacting SNAP recipients who have who are 18 but not yet 50 and who have no minor children in the home, as we are going to start implementing work requirements in some of our counties in Oregon. And so the first thing that we're doing to notify individuals is that we sent out a notice. So this week, 42,000 individuals in 14 counties are receiving this notice. And basically what this notice is doing is letting them know why they are specifically getting this letter. It explains to them what the work requirements are. It also gives them the contact information of the team that we're asking them to connect with, and explaining to them what the change in policy is. We're also providing them with a list of exemptions so they can look at the letter and find or see the letter and see what the exemptions are regarding time limits. We're also providing this information in video format. And for those who are able to use QR codes, they can scan this. And actually, if you pointed at it yourselves right now, you could get the link to a video that explains these changes. So we're sending this to 14 counties, but in June, we are going to send a second notice. And so what we're hoping that will happen is that people will connect with us. We will screen them for the exemptions. If they're not exempt, but they're already doing work activities, we're going to capture those work activities so that they can get credit. And then those who live in certain counties will be receiving a referral to OED so that they can connect with them, and OED can help them create a case plan so that they can meet the work requirements when July comes around. That's the first month that we're going to be implementing the time limits. So before I move on to the next thing I wanted to talk about, are there any questions? All right, I think that was enough awkward pause for me, so I'll continue. So I wanted to talk about the resources that are being created. That are being created for this purpose. So we have this website that people are being directed to. I'm going to share this website on the chat, and it provides the information. The video has been translated into 5 other languages to start with, but we do have resources and ability to communicate with people who do not speak one of those languages already translated. We're providing them information again as to what the time limits, the counties that are impacted. Our communications team was also, they've created a toolkit for community partners that can be used so that you can learn about the time limits, the timelines that we're following. So I'm putting this link on the chat and you can peruse it at your convenience. And other updates to our websites. Let me see, I think our websites are getting updated with this information too. So more resources for you and for individuals that are impacted about this change in policy. When the time comes, I'll be able to talk more about the second notice that we're sending out. I want to clarify, there are 14 counties which are not eligible for a waiver starting July, but because of the intense workload that this new change is creating, Oregon Department of Human Services is making use of discretionary exemptions so that 6 people who reside in 6 counties, even though the time limits should be applying for them, if they're not exempt and not doing work activities, we're going to be using discretionary exemptions from keeping those individuals from losing their SNAP benefits. So we have more information about what a discretionary exemption is, why we're using only in a limited number of places, but I can provide that information in writing. The other thing is that the other 8 counties, so 14 minus 6 leaves us 8 counties. So in those 8 counties, that's where the majority of individuals impacted by this policy is or reside. And so these individuals, like I said, will have access to OED, Oregon Employment Department case management services so that they may receive assistance in completing the hours. If they participate with OED, they also have access to support services such as transportation and other resources that will allow them to engage in those services. And then I see that Heather is here on the call. I don't mean to put you on the spot, but if there's anything else that you think we should share at this time, please feel free to add.
what I would say, you can always put me on the spot, Antonio, you know that. This is the beginning of how we're moving our way back into this work. And this is going to be a big change for our families. It's going to be a big change for the community. This is not going to be the only conversation we have about this policy change. We know that it has some really large implications for people, and so making sure that the word is out there and that you understand as much as possible the program to help explain kind of the effects that these changes will have for families is really important. So I know we just downloaded a lot of information, and I know all of you are going to be clicking on those links as well and exploring the resources that are there. You know, as you do that, if there is anything in there that you would like to have a more in-depth conversation about, or would like to understand a little bit differently or more deeply, and we bring back to this meeting at a future point in time, or there's a need for us to do something a little bit more, please let us know. We want to make sure that you feel supported through this change. We want to make sure that you know how to support our families through this change as well. So it's a big lift, and I deeply appreciate everything that Antonio has done through all of this. There's a lot of organizing that occurs. You know, so like I say, please dig into those websites and the links, take a look. If there's something missing that you think would be helpful for community, we'd really like to know that. If there's a different way that we can be explaining some of that information, since it's so very highly technical, we'd like to hear about that too. So please let us know. Misha, back to you.
Thank you. Did we have any other questions before we move on? So I think Stephanie had a quick update on PEBT. Stephanie?
Hi, yeah, good afternoon, everyone. Just a very brief update on pandemic EBT for summer 2022. So last summer, the EBT cards have started to reach eligible children's homes. And so we've received, contact to our call center asking, just general questions, and families are receiving those. So the EBT cards will continue to be mailed through the end of May. So if you do hear of a household who received the letter stating that their child was eligible, but they have yet to receive the EBT card in the mail, that doesn't mean it's lost or it's not coming. It just means that, our vendor that provides the EBT cards are still in the process of mailing those out. If a household has any questions about, perhaps maybe their EBT card was lost, or if their child is eligible, or just general information about the PEBT program, they can reach out to our call center. I'll add the contact information here in the chat, but they're open Monday through Friday from 8 to 5. And then there's also an email address they can reach out to, but in most circumstances, they will redirect them back to the call center. And that's all I have for PEBT. Thanks, everyone.
Thanks, Stephanie. Anybody have any questions for Stephanie? All right. Well, we have the exciting opportunity to hear from a couple of our partners today. Our first partner that will be presenting is Ava on Outside In. Are you here?
I am here. Yeah. Hi, everyone.
Awesome.
So I'm also going to be sharing my screen. I'm going to be, as mentioned, presenting on Outside In. My name is Eva, I use she, her pronouns, and I'm the manager of our Employment and Education Resource Center. However, that's just one department of a pretty large organization. So I will be doing a general overview, and then if you have more specific questions, I'm happy to answer them. Okay. See. Okay, can everyone see that? let's see.
I don't see it yet. Oh, it's coming up, looks like.
Okay,
There it is.
great. So yes, for those who haven't heard of us, we're Outside In. And our general mission is that we help homeless youth and other marginalized people move towards improved health and self-sufficiency. Our history goes a ways back, certainly long before I started working here, but we've been functioning for over 50 years in various formats. We started as just a very tiny drop-in center as in a little townhouse down the street from where our main building now is, which is what you can see in that picture, and have been growing ever since. So this is our mission. And then what does that mean practically? So the way that we try to meet that goal is that we offer basic services. Services for basic needs, which I'll dive into what that means in a second. We have employment and education support. That's my department and team. We have SNAP and nutrition support, which y'all know about. We have mental health and substance use recovery services specifically designed for LGBTQIA+ youth, as well as comprehensive medical services. And I will be diving into each of those a little bit more. So when I say basic services, we define those as being in our spaces. We're usually referring to food, showers, laundry, communications, such as being able to make a phone call, internet, mail, and then getting started on housing, whether that's shelter or our longer term on-site housing. The place where that starts is what's called our day program. It's the very first point of contact if you are assigned to Outside In. And I actually want to pause a little bit and explain a little bit more about how Outside In fits into a larger system. We are one of 4 organizations that belong to what's called the Homeless Youth Continuum. And that was formed a while back so that we can coordinate in supporting what was a growing number of homeless youth in Portland. All youth who get screened into the continuum are between the ages of 16, that's rare, generally they're 18 to 24, and they get assigned to one of 4 agencies. If they're assigned to Outside In, they come to our day program, they connect with staff there, it's drop-in. We offer 3 meals a day, 6 days a week. There's also just open time where folks can talk to what are called our youth engagement specialists, start getting work, like if they need an ID, if they just got a job and want to look into like if they need a work shirt, they can check their mail. Of course, folks don't have addresses usually that they can use, so they get their mail sent to us. There's internet access, there's rec groups, so they can start to form a community if they're new to town or needed to leave the community they were previously a part of. Bus passes, gift cards, and then we do a lot of work connecting them to shelter and case management. So the organization, Janice, who does all of our screenings, also runs our shelters. Outside In does not have an on-site youth shelter. We have our next piece, which is our transitional living program, also at our main building on Southwest 13th. Oh my gosh, I forgot to copy over. I'm sorry, y'all. Okay, ignore that. It's obviously was a day program. I forgot to copy over the right information. Our transitional living program is designed to be a 1 to 2 year arrangement. And the idea is folks are often coming straight from shelter or from living on the street. So they get about, we provide about 3 months where they're acclimatizing, they're getting used to often to living inside. And then they work really intensively with a case manager one-on-one to start stabilizing, looking into employment, education, if that's something they're interested in, and starting to make a plan for what their next living situation will be. It almost always involves some kind of voucher and will often involve transitioning to working with what's called our community housing team. And those are folks who are helping them get housed in the community, as the name suggests. And there are various programs they can sign up for with that. But that is the basics. We usually we have quite a high capacity. We've been having to make upgrades just based on the space is actually, we've been around for a little while now. So we needed to make some upgrades to the space, but those are getting wrapped up soon. And we house, let's see, let me make sure I get this right. I think, well, it's always varying, people moving in and out, but 16 to 20 people as part of what are called our pods, where folks have their own room and it's connected to a common living space. And then once folks are getting ready to move out or looking at their next steps, they're going to move up to the 4th floor, which are all individual studio apartments. So you're practicing and you have more responsibility. You're responsible for all of your chores and buying your own supplies. So it's that next step towards living independently. So the Employment and Education Resource Center, that's my team. As you can see, I have a little bit more detail on that. Couldn't help myself. That's our front door. We are intentionally located 2 blocks away from the main building on Southwest 11th. So we're still convenient, we're downtown, but the idea behind that was we wanted folks to feel when they were ready to start engaging with employment and education, and actually our SNAP resources are based here as well, that they felt like they were going to school or going somewhere else to get that started. We felt like it was important to have a separate space, like physically, but also mentally, for folks to engage in those things that wasn't where they had breakfast and where they lived, and that it was really important that it was a distinct space. So we have a really awesome spot on Southwest 11th. And we also serve folks 16 to 24. All of the things I've mentioned so far do. We offer something called job readiness training. It's a super intensive 2-week course that gets folks ready for enrolling in college. And then we have a series of paid internships, or sometimes they're ready to just jump into a job and we can support them with that. For folks who aren't feeling quite ready to do job readiness training, it's one of our higher barrier programs. It asks a lot of participants. And so we really want to work with them to get them ready to start rather than just having folks start no matter what. So we have various activities to support them in getting there, building those skills. We've got job retention, stipended short-term trainings. These are in-house trainings on everything from coding to green energy to we had one on salmon. And the idea there is that they're both learning about a specific topic, but they're hearing from people in that field who are currently doing that work and can talk about, if they're interested, how to enter that field. Stipended learning experiences are a little less, maybe they have less of the employment focus. And so those are run through our school and tend to be, essentially, there's some career exploration, but it's mostly focused on just learning about a new topic. We have one-on-one job search support, career spotlights, and we have those where just folks from the community come in and talk about how they got where they currently are. And we do base those on youth interests. So if someone tells us what they're interested in, we go find someone in the community. We do workplace tours and informational interviews. We have an on-site accredited private school called Urban Ed that offers GED tutoring and support with taking the tests 5 days a week. It's completely drop-in, completely one-on-one. So someone can find out about Outside In online, travel to us, enroll that moment, and get tutoring within 30 minutes. The idea is when someone's ready to make a change, we want to be ready to embrace them and offer all the supports we have and be ready to go. So, and we cover all costs related to getting your GED. We also have post-secondary support. So for all folks who graduated from our job readiness training program, they can work one-on-one with a career coach, and they have access to this item down at the bottom here, our renewable scholarship. That is a scholarship they're automatically eligible for when they graduate from JRT. And that helps pay for all transportation, tools, clothing, anything related to college. I mean, we including bike helmets and new glasses. And if you need it to go to class or to attend class online, we will cover it for you. And then we also have college tutoring. A lot of folks have worked with us for years by the time they go to college, and they feel most comfortable coming to us for tutoring. So we do that with our youth while working with transitioning them to outside resources, because folks do age out at 24, and we want to make sure they have the supports they need when they are no longer able to come to the ERC. SNAP and nutrition support. So we're really lucky. We have a full-time, the name is we have a coordinator who works full-time on SNAP outreach and education. Their name is Luca. They're absolutely wonderful. They're on leave right now, which is why I'm here, but normally they'd be talking about Outside In. They do SNAP enrollment, both drop-in and scheduled. They go, ooh, lost my earpiece here. They go shopping with youth to talk about how to mindfully spend your SNAP dollars. They do meal planning for college and work. They run a weekly cooking club. We have seasonal free food markets at the main building. And then they do nutrition education in other ways as well. One thing that Luke has done that's really cool is they've started collaborate with other teams at Outside In. So we have recovery support groups. They're collaborating with some of our recovery support groups to offer nutrition education in those spaces as well. So yeah, they're just wonderful, and we're excited to have them back in a little bit. Sorry, not a lot of detail on this. We have a really comprehensive, we call it behavioral health or mental health and substance use recovery program. It's very separate from the youth department, which covered all the previous services I mentioned. And for legal reasons, it's much more private. So I know the services we offer, but I'm not privy to nearly as many of them. So there are three main areas that our behavioral health team covers. We have an outpatient counseling team. These are for our youth who may be struggling with like specific mental health issues, but are not super high acuity. So they're not necessarily at great risk of like being arrested or ending up at Unity or in the hospital. They may be for the most part able to maintain housing, maybe go to their job, but they're really needing some more intensive counseling for trauma they've endured or things that are currently still happening. I'm gonna actually skip down to what's called ACT. That is our much more intensive program. Stands for Assertive Community Treatment Team. It's kind of like two T's, but treatment team. And that is the most intensive wraparound behavioral support model that I've ever seen. It includes permanent supportive housing. That means their housing, if they're able to maintain certain agreements, is paid for the rest of their life. They have intensive 24-hour support. These are folks who usually by the time they're screened into the ACT program, they have been in and out of the emergency room and engaged with the police really frequently, and often had several stays at Unity or other like urgent mental health care locations. So the idea is that we're able to offer a really comprehensive supportive environment for them to hopefully start to gain some stability. We work with a lot of those clients in our spaces. And as much as we can, we do collaborate with the ACT team on supporting them, but there's significant privacy considerations there. And then DBT stands for Dialectical Behavioral Therapy. We offer services for both staff and youth, which is really cool. They recently started offering a group for staff, and that is really wonderful. Any youth can really participate in that. So that is available to all folks, whether they're in the outpatient counseling or ACT team or not.
Ava, I'm sorry
Yes.
to interrupt you, but we're out of time.
Okay,
Can you
great.
just summarize whatever is left on the rest of your slides, and then
Absolutely,
we can
I'll just
provide
name
these
them.
slides with the follow-up so they can, continue if we're missing any information.
Yeah, there's a lot. We have LGBTQIA+ services. I'll be sending this out. And our medical services could be its own presentation. We have multiple clinics, a pharmacy, a needle exchange, the second in the country, and then really comprehensive transgender and gender diverse services. And that's it. Thank you.
Thank you. I'm so sorry to rush.
No.
If folks have questions for Ava, maybe you can put them in the chat and she can try to address those, or we can ask afterwards and get those sent out with our follow-up. I do see that our next presenter is here, Ashley with Family Tree Relief Nursery. Hi, Ashley.
Hello. I will try to keep it super short and brief. I was having some issues with our slides, so I'm just going to talk about our services, and if anyone has any questions, please feel free to reach out. So my name is Ashley Greiner, and I'm the program manager and supervisor of the Therapeutic Early Childhood Program at Family Tree. And I oversee our therapeutic classroom and services in Lebanon, Sweet Home, and SIO. So some of our more rural communities. I'm not sure if you guys are familiar with Relief Nursery, but Relief Nursery started in the 1970s as a way to respond to the increasing number of children that were being removed from their homes and placed into foster care. So a group of individuals came together and started what was called respite services. So that's something that we offer at Family Tree. So we have a variety of different programs. One of our programs is peer services program. So those are individuals who work with individuals and families in the community who are going through the recovery process. They may be trying to get into treatment. They may be coming out of corrections. Maybe they just had their kids return to the home. And so they're individuals who have lived experience to walk alongside those families as they're navigating that transition. We also have a family services program. That program primarily works with families who are receiving services from the self-sufficiency department. So TANF. We also do, we're not currently doing visitation, but it is something we've done in the past. And then that program primarily works with adults who have older children, older than 6. And then we have the therapeutic early childhood program. So we have classroom services in Lebanon and Albany, and I'm over in Sweet Home today. We just opened a classroom here. All of our programs, regardless if it's peer services, family services, or therapeutic early childhood, we're all home visiting based services. So that's what we tell families when they call and request our services. We let them know that we're a home visiting based organization. Our primary role and goal is to meet families where they're at and try to reduce and or eliminate stressors in the home that can lead to childhood abuse and neglect. So we are an abuse and neglect prevention agency. We do a lot of modeling. Most of the families that are in the TECP program have to have at least 5 risk stressors to be enrolled in our program. It is very common that the families that we work with have anywhere between 13 and 15. I won't go over the whole list because it's long, but some of those stressors could be lack of employment, lack of transportation, single parent households under the 200% poverty level, families who come from an ethnic or minority background, substance use in the family, mental health. So there's lots. We are a free program. So families can come to us and seek services. We offer some really great classroom programs for children. The therapeutic model is really focused and based around supporting children through their early years of development. So I always giggle and say, we don't focus as much on the 1, 2, 3s and the ABCs. We're more about talking about social and emotional development and how to regulate our feelings. We do work with a lot of children who have additional needs, who maybe need those extra supports as they navigate, going into other preschool programs or as they transition into kindergarten. The relief nursery model is great in the sense that the classroom ratios are very small. We never have more than 8 toddlers and 3 adults, and we never have more than 11 preschoolers and 8 adults, or I'm sorry, 3 adults. So very low class numbers. And yeah, basically, like I said, we go out and we meet with families at least once a month. Sometimes families request that we come weekly. We'll do that. Sometimes families ask if we can come bi-weekly. And really, we just go and we listen and we see what kind of stressors they're having and how we can connect them with resources in the community. We support with SNAP. So we can print off applications, we can kind of walk them through. We're not eligibility specialists, so we don't, tell them that that they're approved, but we just let them know that here's the application, here's the information, how can we support with that? We help with getting connected with OHP. We have a couple of staff, including myself, who are OHP assisters, so we can help families navigate that. We have some really great in-house resources. We have a clothing closet for children birth to 6. We have a supplemental food pantry that families can access. We have hygiene supplies and diapers and wipes. So our services specifically in the TECP program are voluntary. Most of our referrals come from word of mouth, or my sister-in-law, received your services and said it was really helpful. So families can do an intake, and then, the hope is that we'll provide them with the resources and tools that they need so that they can feel confident in exiting our program, so that when they're out in the community and they don't have a family support specialist or a teacher, that they have those skills and those abilities to advocate and seek those services from themselves for themselves. I wanted to add a little snippet as well that we are starting up parent education next week. A lot of individuals and families in the community have utilized that resource in the past. COVID kind of put a small damper on that. So I'm happy to say that we are starting our nurturing parenting class next Thursday, May 4th. It's from 5:30 to 7 every Thursday for 14 weeks. It's open to the community. You do not have to be enrolled in any sort of services with Family Tree to attend. Free childcare and dinner are provided. We also offer transportation support. So if you have a family, it is in Albany, but if you have a family that would like to attend and doesn't have car transportation, we can pick them up on our school bus, or we can support with gas cards and vouchers as well. So we're excited to have that back. We usually do a couple different rotations a year. So we'll do nurturing parenting, which is really kind of every topic of parenting you could think of. We offer a SUDS, so a substance use disorder class. We offer nurturing parenting in Spanish, and then we typically rotate and every so often do a father's group, which is for dads of young children. That was a lot, but I'm an open book and I am more than happy to share more. So we're just really excited to be here and partner with everyone. And yeah, feel free to reach out to me if you have any questions.
Thank you, Ashley. We do need to go on to our next presenter, but if you could maybe put your contact information in the chat, I think that would be really helpful for folks.
Can I just ask one thing, Misha, before we transition through?
Sure.
Ashley, would you be willing to come back and let us know how some of those classes go?
Yeah, I'd be more than happy to share. We're really excited. It's a great resource that's utilized by a lot of families who are required to take parent education classes, and that has been a rare resource in the past couple of years. So I'd be more than happy to follow up and let you guys know how those are going.
Thank you. Really appreciate that. Sounds fantastic.
Sorry about that. I was typing. All right. Our next presenter is going to talk to us about food for all. Maria, are you here?
Hey everyone.
Ask you a question.
Gosh, I
For
didn't
the
know
report,
I was an actual presenter.
We're QAing it.
Sorry about that. Go ahead.
That's okay. Hey everyone. For those who don't know me, my name is Maria Klimenko, and I'm the legislative coordinator for self-sufficiency. And I just wanted to give you a quick update. Not a ton has changed since our last meeting, but one of the main bills we've been following this session that relates to SNAP is Senate Bill 610, which is food for all. And essentially what it would do is provide SNAP-like benefits funded by the state to folks who are currently eligible, with the exception of immigration status. So initially, one of the largest partners who has been advocating for this bill is Oregon Food Bank, along with Partners for a Hunger-Free Oregon and other advocates. So this is modeled after a similar idea like Cover All People, which was passed last year. And, you know, this has been a little bit of a challenge in terms of paying for this bill. So we initially did a fiscal estimate for Partners, and it came out to just slightly over 120 million, which realistically wasn't very feasible for this session. So most recently, we've been asked to scale down and prioritize population based on age. So we have done sort of a new fiscal estimate for Partners, trying to figure out how to best use 20 million, maybe a little bit more, prioritizing youth as well as older adults age 55 and up. As I mentioned before, one of the challenges is the system that we're working with. So the one system, as well as the Oregon Eligibility Partnership, and really how long it takes to make changes in the system. All legislators have been asked to pick their top 3 bills to present to Ways and Means. So we know that Campos is going to be advocating this as part of her top 3. So in the meantime, we're trying to set up a few different scenarios with lower funding amounts. And after that, we're going to know a little bit more probably once we know specifically how much will be allocated to this sometime after May 17th. So does anyone have any questions for me regarding this bill? Okay, great. And then I know that Misha and I have also discussed if anyone wants a little bit more of an in-depth legislative overview and some of the bills we're following, whether it's related to SNAP or other self-sufficiency program, please feel free to reach out to Misha or myself, and we'd be happy to schedule a more in-depth session. Thank you so much.
Thank you, Maria. All right. So we've got exactly 10 minutes left in our meeting, and I would just like to open it up at this point. If anyone has a question for any of our presenters that they didn't have the opportunity to ask, or any additional information that maybe they'd like to share regarding one of the topics that was presented today, maybe we could start there. Does anybody have anything?
Hi, this is Venus here with Partners for Hunger Free Oregon, community organizer. I use she, her pronouns. I just had a question to the community at large. I know kids are schools, they're getting their PEBT cards for the summer. I was just curious if there was any programs or heard of anything that helps parents with the outstanding balance of the school meals, or if anyone's ever heard of that, helping with that for parents. I had that question presented to me.
Does anybody have any thoughts around that? I know that this is very community specific, but that some of our faith communities and the faith-based organizations sometimes have some discretionary funds or programs that they will utilize to help folks who have needs, and they just need to apply to those, whatever that system looks like for that particular space. So that's the first thing that came to mind for me. Does anybody else have any thoughts?
Venus, have you connected at all with anybody at the Child Nutrition Program to see if they know of anything?
I haven't, but that's a great idea. I'll start there. Thank you so much.
Yeah, and if you need any help, let us know. We can reach out to some of our contacts as well overseas, because I'm sure there's going to be many families that are facing the same kind of situations that you're talking about.
Thank you, Heather. Any other thoughts or questions that folks wanted to bring up about what we've discussed so far today, anyway?
OHA to do a grant around tobacco cessation. So I'm working with one of my staff to support expectant mothers who are 0 to 36 weeks gestation, quit over 300 types of tobacco products it. So it's a free program. We're actually partnering with an organization based out of New York called Baby and Me Tobacco Free. So individuals who are interested that are between 0 and 36 weeks are eligible for one-on-one counseling and support. Everything is done via telehealth. They found that even before COVID, that was the best method for families to get their needs met. Everything is provided for them. You know, we were really transparent in the beginning when we were trying to figure out what kind of support we wanted to lend to individuals, is that not all families that we work with have access to internet or phones or anything like that. And so those items are provided as well. And then they also receive postpartum support. And for participating in the program, they get free diapers and wipes via little vouchers. So that is something that we are currently working on. It's open to anyone in the community, Lynn or Benton, and they can call us directly and let us know that they're interested in that. So I just wanted to share that with everyone in the community, that that's a resource that is available. So.
Thanks, Ashley. Have you reached out to Polywog so they can update their database and all that you offer? I know you're involved with them.
Yeah, so Deanna Barclay, who basically does exactly what I do, but in Albany, I believe she attends those meetings, and then I've given a small presentation for them as well. I know one of our kind of big contacts right now has been Samaritan maternity care coordinators. One of the nice things about this program is that you can double dip. So if you're receiving supports with wanting to quit over 300 types of tobacco products, and you're getting services through Samaritan by chance, that doesn't mean that you can't also participate in Baby and Me Tobacco Free.
Awesome. Thank you. All right, we've got 4 minutes left. Is there anything anyone was hoping to have the opportunity to talk about today that we didn't get to or didn't plan? We would be happy to open the floor now.
If I can plant something, Misha, I would really appreciate it. If I can steal the last few minutes.
Plant away.
Thank you. Just to be, very transparent around the SNAP fraud state plan. I know you've all had lots of questions about it. We've got a very small window of opportunity to do some of this work initially around launching it, and we really need your help. So what we have is likely going to be an opportunity to connect with you probably early next week is what we're looking at right now. We have just received, literally, I think it was, well, not very long ago, an email right before this meeting from our federal partners letting us know that we'll be able to move forward with the federal plan for replacements of SNAP benefits for phishing and skimming activities. And so I know this is something that has been weighing on everybody's minds here on this call. We've had very little ability to really craft what that plan looks like. A lot of it was very prescriptively given to the states through the omnibus bill guidance that came out. We've not had much flexibility in terms of how or what we can do for replacement of those benefits. They've been very prescriptive on those things, but we really want to make sure that you understand kind of like what that plan is going to be, what our next steps are going to be, and we'd like to involve as many of you as possible in the communication efforts that we're going to be doing as an agency very rapidly now. There's going to be a window of time for our families to be able to look at some of those replacement benefits from prior months where we didn't have the opportunity to replace these services. And then there's going to be some guidance that we need to make sure we give to families about moving forward from this moment in time and what they need to do if something happens in the future. So, as I say, planting a seed, we will get something out to you as quickly as we can to really poll the best time next week to connect with you all and really start some of those other planning pieces that you're so important in helping us get our message out. I really wish I'd had more time to be able to To give you a better update on that, we are meeting for some additional clarification with our federal partners tomorrow, and I'm hoping that will clear up all of the remaining questions that we still have. And then it will be over to us all to get that work done together. So in advance, thank you. I appreciate all of the questions, all of the focus you've already given on this, and everything that I know that you're all going to do in terms of helping our families and our SNAP participants in the next few weeks, months, for however long we have this program. I really appreciate the work, and I know that that's a really, timing is awful on this. I'm sure I have just made everyone have 1,000,001 questions. I promise you we'll make space for you to be able to answer as much as we can.